Kia ora tātou. Welcome to our session tonight. And I'm pleased to, well, first of all, I'm Muriel. I'm one of the co-presidents for Ed2, and happy to open with a karakia and a short mihi to our audience and guest speakers tonight. So we'll just take a pause for now and I'll open us up. Kia hora te marino, kia whakapapa pounamu te moana, hei huarahi mā tātou I te rangi nei, aroha atu, aroha mai, tātou ia tātou katoa, hui e, tai ki e. May peace be widespread, may the sea be calm like greenstone and a pathway for us all this day. Let us wish pathway te rangi nei, aroha atu, aroha mai, Amene. So wherever you're tuning in from tonight, thanks for joining us tonight for this session. I particularly want to mihi to our guest speakers tonight, Dr. Siobhan Trevallyan, a clinical director and GP at Waitakere Union Health Service. It's also an accredited living wage employer, and Dr. Siouxsie Wies, who really needs no introduction to us, our audience tonight. No mai korua, mihi kia koutou katoa, and welcome, and over to you, Annie.
Kia ora koutou, my name's Annie Newman. I'm a co-Assistant National Secretary for Ed2, and very warm welcome to our Facebook Live. I want to just acknowledge a few others on this call for this evening, including Marianne Bishop, who's our Community Support National Executive Representative, and also we've got some staff members joining us to assist, Sam Jones, who's a Director for Ed2, and Andrea Rushton, who is a team leader, and they're going to assist in some of the questions, and also if there are comments in chat, they're going to help out with those as well. As Muriel said, we've got a couple of very distinguished guests to join us, experts from the field of COVID-19. So Dr. Siouxsie Wies, microbiologist, science commentator, and associate professor at the University of Auckland, and also Dr. Siobhan Trevallyan, clinical director at Waitakere Union Health Service. And that's a service that provides free care to our members and their families in West Auckland. And so we're very privileged to have you join us. We know that you're busy, both of you. Now, I know that you're in a lot of demand in this environment, so we appreciate the generosity of giving some time to our members and to the questions that they've got, and we're going to go through some of those a wee bit later. But before we get there, I'm going to invite our Ed2 National Secretary, Bill Newson, to open up the conversation for the evening and give us a bit of a bigger picture overview of the COVID situation. Over to you, Bill.
Well, thanks, Annie. Tēnā koutou katoa. Welcome, Ed2 members. I want to particularly acknowledge any Ed2 members on the video, on the call, who are essential workers and frontline border workers. My thanks to you. As you all know, the Delta variant is far more transmissible than the COVID variant we had last year, and it got a head start before being detected in the community, and that head start has given it an underlying momentum to the community transfer that must be dealt with. And so therefore Ed2 endorses the government's lockdown, containment and elimination strategy, and I'm asking on behalf of Ed2 that all members play our part collectively in supporting that lockdown, and I know that Ed2 members are. There are a range of views about vaccination, and I want to just make a few points about that before moving on. We endorse the vaccination strategy and we recommend members get vaccinated for good reason. It is a personal health issue, but it's not just a health issue. There is a risk that the individual choice to vaccinate or not could potentially become a serious employment issue for some members, and that's where we do come in. Now, currently mandated vaccination applies to frontline border staff and MIQ staff. However, other employers are now turning their attention to requiring staff vaccinations. They can't just decree that you shall be vaccinated or hold you down and give you a shot. They should and must undertake a genuine risk assessment first. But that assessment may result in identifying work that should be done by a vaccinated worker for wider health and safety reasons. The employer may then take steps to ensure that this happens. Now, our principles of approach as a union are clear. There must be a genuine risk assessment. Workers should be supported to get vaccinated in their employment, paid time off, that sort of thing. There should be clear information. Workers' issues need to be considered. There could be genuine health issues. In that case, consideration should be given to control measures, PPE or redeployment options. But our bottom line concern is that if an unvaccinated worker is no longer able to fulfill the work they were employed to do, because the assessment showed that it should be done by a vaccinated worker, then there is a clear risk that termination could be an outcome. Now, we stand up for our members and we defend our members, but that's an outcome that unions may not be able to overturn in law. And so vaccination is a very serious decision in terms of personal, whānau and collective health reasons, but also for employment reasons. And that's why we want our members to be fully informed. And that's why I really appreciate our guests coming on this call this evening.
Kia ora, Bill, and yes, thank you very much. I think one of the things that we always are remembering is that many of our members are essential workers, and COVID-19 is an ever-present reality. And so too, of course, the vaccine Pfizer. It's a good opportunity now to introduce our first guest, Dr. Siouxsie Wies. A very warm welcome to our Facebook Live tonight. I'm going to hand it over to you for 5 to 7 minutes to speak a bit about the science of the COVID vaccine. Over to you, Siouxsie.
Thank you very much. Can you give me a hand signal when my kind of 5 minutes is up? That would be fantastic. Super. So yes, thank you so much for inviting me, and I'm absolutely delighted to be here to talk to you about the science. I think it's going to be probably come out when we start doing questions, because 5 minutes is not a lot of time to tell you about the science of vaccination and things. I guess there's a couple of things that I do want to raise though. So one of the things that I hear a lot is that people are frightened because, or not frightened, but have questions about how quickly the vaccines were developed, how quickly they've got into use in people, when we've heard for so many other medicines and vaccines that they might take, 5 to 10 years or something. So the answer to that is really quite simple, and that answer is money. So normally, there is a process where we have these different types of trials, phase 1, phase 2, and phase 3, and they normally happen one after the other, with quite long gaps in the middle while everybody decides who's going to pay for the next stage. And clinical trials are not cheap. So they go after the other with these big gaps in the middle. And then at the end, there's quite a long process where all that information from all of the trials is gathered together to give to the regulators, who then go through all that information to then decide whether they're going to actually then release give that approval to that, whatever that medicine was. And then starts the manufacturing. So no company is going to commit to manufacturing something that isn't going to get approval. So after it's all approved, then starts the manufacturing, and then something can end up being given to people. So that process takes a long time when you do it that way. With COVID-19, there was a very, very clear need for a vaccine. And so at the very beginning of the pandemic, scientists who normally work on vaccines, but for other organisms, basically pivoted straight away to trying to make vaccines for this particular virus. And that meant that lots of different types of vaccines went into clinical trials very quickly. A whole bunch of governments and NGOs and philanthropic organizations then threw huge amounts of money at all of these research groups, at being able to do trials. And so the trials, instead of being done one after the other, were staggered. So there was basically, they would start the safety trials and the dosage trials, and then as soon as the data was looking good from that, they would start the next phase while carrying on with the first ones. And then while those ones were looking good enough, they would start the phase 3 trials. So everything's being kind of staggered and really compressed. At the same time, the data has been given to the regulators on a rolling basis. So the regulators have been able to look at that information as it's been coming in and evaluate it rather than waiting to the end. The other really big difference is that organizations like the Bill and Melinda Gates Foundation, various governments, put money into building factories that would start producing different vaccine candidates, so that whichever ones were successful were already being manufactured when that approval happened. And that basically meant then that when approval happened, it happened faster, and there were already doses that had been manufactured and were ready to go out to people. So this is why everything's kind of happened really fast. And I think it shows us how we can do it, how it would be amazing if we did it this way for other really serious diseases that, you know, we're looking for cures and things for. But the other really important thing, I think, is to bear in mind that so while the trials and everything feel like it's been done very fast, it is based on decades of research into all of these different types of things. So decades of research onto coronaviruses, decades of research in the case of the Pfizer vaccines into mRNA, and decades of research into ways to deliver different medicines, including the way that the mRNA is delivered. So while it can feel really quick and that makes people feel really nervous, actually it's built on some really amazing science, and no corners have been cut. I think that's a really, really important thing to say. And now there are billions of doses of these different vaccines that have been going into people, and it's looking pretty damn amazing. So I'm kind of, as a scientist, really excited by how far things have come. I would much rather we weren't in a pandemic and COVID hadn't happened at all. But no, the fact that we have made this amount of progress in just over a year is quite amazing. If I've got one more minute, what I also want to just highlight is one of the most dangerous things that we face now is not just the virus, but basically misinformation. So there is so much fake information circulating around the internet about the pandemic itself and also about vaccines. And that information is deadly. And so I just want to tell you really briefly about a study that was done earlier this year, which looked at information on social media. They took millions of different posts, looked at to see whether they were fake or real or true information, and then traced back to see where they came from. And basically, about 2/3 or 3/4 of the fake information on social media about the vaccines can be traced back to just 12 accounts based out of the USA. So these people are people who for many years have made up fake information about all sorts of things because they do it to make money. So they have companies that make millions of dollars a year by selling books or selling webinars or selling fake cures. And when COVID-19 came along, they pivoted. Just like all of us had to pivot, they did that, and they basically moved to COVID. And so what we've seen is that basically different people around the world, including here in New Zealand, are taking that information that they're putting out and then repackaging it for us. So there are people who are basically making money from it. And that's kind of why they're lying about this stuff. And it can be so hard to know what's true and what's not. Because there's basically these people who are putting all this stuff out there. So I guess just be wary. If information is they'll often ask you for money, or they'll be trying to sell something or shove something like a miracle cure at you. And they will focus on talking about the pandemic as though it's not particularly serious, like everybody's, making a big deal out of nothing. And they will focus on your personal freedoms. And I think as union members, we all know how important collective action is, right? And so when you see things that are focused on your individual freedoms, know that it's somebody who's trying to undermine your collective action. Thank you.
Thank you very much, Siouxsie, for that very, very clear explanation about the process that the vaccination's gone through to alleviate some of people's fears. I would now like to introduce Siobhan Trevallyan, who is the Clinical Director and GP at the Waitakere Union Health. over to you. Thank you.
Unmute myself. Kia ora tātou, ko Owairaka te maunga, ko Strangford Lock to Awa, no Tamaki Aho, ko Trevallyan toku whānau, ko Siobhan toku ingoa. It is such a pleasure to be with you guys tonight. It is absolutely marvellous. We have obviously had all of our worlds overturned by COVID, and you know, whilst New Zealand has done extraordinarily well compared with the rest of the world, it's still had a big impact. I was asked to introduce sort of what primary care has done in terms of COVID and how we're responding now in the current little outbreak that we're having. And I reflected back to March last year when we saw things developing across the world and how suddenly it all changed, and the fear that I had fear for my family, I had extraordinary fear for my patients. We look after some incredible people out there in Waitakere, and I didn't want to lose a single one. I was really scared. I was scared of my colleagues. We were dealing with this stuff day in and day out. I didn't want them to get sick. And then, of course, I've got a family too, and I was worried about them. But then as I started seeing what was developing overseas and how my international colleagues were suffering and dying and struggling with the overwhelming burden of COVID, I started to take real pride in what New Zealand's done. Bill's absolutely right. The strategy of stamping it out has just been brilliant. It is saving us lives. It is keeping the country going. It has kept our economy strong. As we moved through the first lockdown, which was really long, I started to realise that my patients at Waitakere Union Health Centre, being largely union members, were also largely working, because you guys are all essential workers. You keep the country going. You're really incredibly important, and your health and welfare is just so important to me personally, but also to the whole country to keep you going. And I just want to say thank you to all of you. You know, the doctors and nurses get a little bit of glory at times like this, but you guys are actually the ones that keep the country moving. And I just want to say thank you. All right. Our response as we came out of lockdown was relief, as it was for everybody. But then we learnt a lot. We learnt a lot about providing services over the phone, by video, by email. We're getting patients emailing us photos of their rashes so we can help with that straight away, you know, whereas previously you had to like book an appointment, come in 3 days later. It was, things have really shifted for us, and we've kept a lot of those services going. And then we had a second lockdown in August, and I have to say, there was one point there where those people that had COVID, a third of them were my patients. That didn't fill me with pride. It filled me with massive anxiety. I didn't lose any of them though, and I was really happy with that. And I was happy with the support and the service that we were able to provide for them as they struggled with their very, very scary illnesses. And then we came out of that again, and we had a lovely summer, and it was great. And we all got together and had Christmas and went to the beaches. We carried on doing the telehealth, managing things by email, and then we started to prepare for vaccine delivery, which I think we've all seen as this huge relief as it's what rolled out across the country. And we've now done, you know, such an extraordinary number of vaccinations in a really short period of time. Most of those vaccinations have been given in central vaccination centres run by the hospitals and DHBs. But we've now got 90 general practices across New Zealand providing vaccines, and we're one of those, and we're really proud of that. To get there, I had to do hours and hours of filling in forms and extra training, and then I had to make all my staff do that too. They're not saying thank you very much for that. The assessment process was extraordinarily rigorous. We have people watching us pulling up things in syringes to make sure there's no air bubbles. We've done it at the right temperature. It's sitting out of the light. It's incredibly rigorous. What we know is if we deliver this vaccine program properly, we will protect the country from COVID. and that's what we want. But we really know that it's really critical that as many people as possible get vaccinated and get 2 shots. And that's going to be really important for us going forward. So again, we're really proud of the changes that we've made, and we're really proud to serve you guys. That's why we come to work every day. We're fantastic people. And we're also really proud to be part of the New Zealand response to COVID. I look forward to answering some really curly questions. Thank you.
Thank you, Siobhan. And I guess it's wonderful for our members to hear you speak as well, because we know the work that you do for us. And I think the wisdom that both of you bring to this conversation is incredibly important, because for many of us, we're in the dark, and this is a real opportunity to ask questions. And so we're going to get into that next phase where we have invited our members to put up some questions, and we do have a few. So I'm going to start with one for you, Siouxsie. Is the vaccine effective in helping to prevent the spread of COVID-19?
Okay, so obviously what we would love is for a vaccine that stop people from getting COVID at all and stop them from transmitting it. And unfortunately, some people we know will still test positive, so they'll still catch COVID once they've been vaccinated, although this is a much lower number than obviously if we weren't vaccinated. And a small number of those will transmit the virus too. What's really, really important to remember is that so the data is showing that when people are vaccinated, if they shed virus, they will shed virus for a much shorter period of time. So if they are infectious, they will be infectious for a much shorter period of time. And with Delta, every day counts. So the less time somebody is infectious, the less chances that they have to pass it on to someone else. So it's a really unfortunate thing that this particular, these vaccines don't stop this particular virus completely, but they do something. They are effective. And because Delta is so much more infectious, every single day that somebody's not infectious, that makes all the difference.
Thank you. Now, there's a question here for you, Siobhan. Can you tell us about the adverse reactions to the vaccine? You're on mute.
Sorry about that. So what we mean by adverse reactions is the things that you feel after you've had the vaccine. So, and generally the bad things that you feel. And with any medicine, there's a risk of having some sort of a reaction or a response that's unpleasant. With vaccinations, we know a lot about them because, of course, we give millions of vaccinations for millions of different things, and all vaccinations have some things that are likely to happen. So a little bit of stuff is put into your arm and your body reacts against it, and that means that you can get a little bit of a sore arm. I didn't after my first one. I forgot I had it. It was that mild. After the second one, I did get a bit of a sore arm. I bumped it on the side of a door a couple of days later, and I was like, oh yeah, that's right, that happened. And that's your body recognizing the stuff as foreign, developing an immune response, and remembering that the next time you might get exposed. Sometimes your body's really, really good at responding to that foreign substance, and it sets up a really good going immune response. And for those people, they might get more side effects, bad reactions, things like aches and pains across their body. Some people feel tired, even a little bit of a fever. You might feel like a little bit of a flu-like thing going on. That's pretty common, especially after the second dose. And that's because your body's been primed a little bit. It's had a little bit at first, it's another little bit with the second dose, and it goes, right, I know what to do, I fight this. And that's basically the science behind the adverse reactions for vaccinations. There are some very rare side effects as well, and we need to be upfront about those. So we're not pretending there's no risk at all with these. There's about a 3 in 100,000 chance of getting a severe heart reaction. We think, we don't even have good science on that, but we know it's incredibly rare. And that's with our Pfizer vaccination that we've got here in New Zealand. We know that the risk of getting a heart reaction from getting COVID is at least 3 times as high as that. And of course, there's a lot of other downsides of getting COVID, death being the most important one. Okay.
Thank you, Siobhan. That's great. I'm just going to read out the next question. This one comes from a delegate, and I might direct that towards you, Siouxsie. Kia ora, I'm a delegate working in the aged care sector. There are scientific reports of waning immunity 3 to 6 months after 2 jabs. Is New Zealand considering booster shots? And if so, when might this occur, and can we expect frontline and essential workers to be prioritised?
I obviously can't tell you about government policy, but the government has had, essentially those who are most at risk of getting infected being first in line for vaccinations. I would hope that the way that the pandemic is playing out and our outbreak is playing out is that they would make all essential workers part of that frontline thing, I think, in future. So that's certainly something that I'll be advocating for. But in terms of how long the immune response lasts, so this is something that obviously we, this is the trials have only started, whatever it was, less than a year ago. So this is data that's still being gathered. One of the things that people have said one of the reasons they think that it might be waning is from some data that came out of Israel. And actually, if you analyze that data differently, it doesn't look like the boosters are needed much yet. So we do know that basically what's happening in Israel is they're having another surge of cases and they're seeing some vaccinated people in hospital. And this is what's leading them to go, oh no, that looks like the vaccines aren't working anymore. But if you basically look at it by age, actually the vaccines are still very, very effective. So if they're waning, it might only be by about 10% or something. So I think we need to be a bit cautious about whether they're needed right now. They will definitely be needed in the future. We do this for other vaccines. So if you think about tetanus, people get a tetanus shot, usually recommended every 10 years or something. So there are ones that we do boost for. But we might need to boost if the virus changes enough that the antibodies that we've made from this particular vaccine are not as effective anymore. And so that we will find out as the virus changes. And so the last thing we want is to be boosting basically with the wrong vaccine. So we may well end up seeing a bit like the flu vaccine, where we get a new one of that every year. That's because the flu virus basically changes. And so the new vaccine is every year the vaccine is reformulated for the new strains. And so that is probably going forward what we will have to do with COVID. So it will both boost, but be against the right version of the virus.
Okay, and I think that probably answers the next question, which is how likely is it that new variants in the future will require a new vaccine? So I'm going to just move to the fifth question, which is a little bit along the same theme, which is how do we know about what do we know about the C12 variant? I think it's something called MU, is it? I'm not sure. The advanced South African variant, or is that just talk?
Okay, so when a new, it's called a variant of interest arises. So basically around the world, various groups are sequencing virus isolates as they happen. And what we are seeing is mutations that are happening in the virus that look like they're concerning. So we're looking for mutations in the spike protein and various other things that scientists know those are parts of the virus that are really important in binding to cells or in potentially being recognized by immune response. So as these mutations appear in a strain, the strain will basically get given a letter of the Greek alphabet. And then as data accumulates about whether those mutations or that particular strain is actually concerning, then it becomes a variant of concern. So alpha and delta are the ones. Delta at the moment is the big one that's a variant of concern. So we know there's really good evidence that delta is more infectious and that something like twice as many people will be, or you've got twice as high a chance of being hospitalized. Mu, or the South African one, are basically, they've got some of these mutations. So they might be on their way to being a variant of concern, but at the moment there isn't enough evidence. So and this happens this mutation is a completely natural process that happens just by sheer chance every time the virus replicates. And the reason we're seeing it is because so many countries around the world are not stopping transmission. So the more community transmission we have, the more chances of these rare mistakes being made, the more chances that it will be a mistake that basically makes it a variant that has some advantage like Delta does.
Okay, that's extremely interesting. I'm going to move into sort of some PPE questions now, and I'm going to ask Siobhan, somebody has asked, does the 2 metre space help, or do we need to be doing more to prevent catching COVID when we're in workplaces together?
So I guess the question of risk in the workplace is quite specific to the time. So are we in the middle of a level 4 lockdown where the risks are very much higher? Are we level 1? What type of work are you doing? Are you in a closed confined environment with lots of staff, so you're close to other people? Are you working with sick people? So my specific risks in my job as a GP are really super high right now. Everybody's got coughs and colds. I'm taking swabs. I'm, vaccinating on different days to when I'm taking swabs. But, I'm doing all of these things in a relatively high risk environment, close spaces, consultation rooms and things. So yeah, I need PPE, and I need proper PPE put on properly, taken off properly, and worn all the time.
Actually, similar to that is the question about clients. Should we be insured? We've got a lot of our members are in places like idea services and other health environments. And should we be ensuring that clients are wearing masks as well as the people who are caring for them?
I mean, that's a really good point. So I am able in my work to request all of my patients to wear masks, and generally speaking they all do, and that's really good. But there are some situations where they can't, they choose not to, they have breathing difficulties and can't, they don't understand necessarily the importance of them. And Idea Services is probably going to be one of those communities where wearing a mask correctly or at all is going to be really difficult.
I'm actually going to just hand it over to Sam on that one, because I think that you've just set something off for him about the reality of exemptions in some places, Sam.
Yeah, so a lot of the clients in disability support are non-verbal. You've got people with all sorts of different behaviours, and then there's people who they need to visually, even for the worker, they need to visually see their face, see what they're saying to them, and it can cause other risks for the worker if you were to change that or try and force anything. And so informed consent is absolutely crucial. And then once we get to different levels of lockdown, when you're out in the public and you're getting the side eye from Joe Public walking around seeing you with a client without a mask, there's cards around, there's education happening so that people understand that it's not mandatory. And you could just think of someone who's hearing impaired, for example. Lip reading's hugely important for them, and so we have to be a bit sensible about how we approach that.
And I think it's part of the package. We talk about PPE a lot, but actually physical distancing, washing your hands, staying home if you're sick, coughing in your elbow, all of those things are equally important. And of course the vaccination is one of our key responses.
Yes, it's interesting that the next question actually focuses on the science behind wearing masks and whether, non-vaccinated staff have to wear a mask, some of those sorts of questions. What's your view around that? If I can just maybe read it so that people are clear about that. I'm a union delegate working in aged care. At least one aged care provider is requiring non-vaccinated staff to wear full PPE throughout their shift. And this means masks, face shields, gowns and gloves. Is that approach backed by science, and is it the best solution to keep people safe?
Again, it comes down to the specific risks of where they're working and who the clients are that they're working with. It sounds really hot, And I don't like wearing PPE. I mean, obviously I'm vaccinated, but I'd probably change my mind after a day in full PPE. There is good science that PPE works. Okay, so it does prevent infection, it does prevent transmission. Again, it's going to come down to, are we in a level 4 situation where there's enough out there in the Auckland community that you could be a potential risk to some very vulnerable people? And as Bill was saying at the start of our meeting tonight, it is about doing a full risk assessment. You know, what is the actual risk to the people that you're looking after? What is your risk of contracting it in a healthcare setting? Because that's the other thing. We know that this virus loves hospitals and rest homes, and is transmitted pretty fast in those environments. So yeah, PPE does work, and if your employer has looked at it and decided that you can safely do your work only in PPE, then question that, but they're probably right.
Okay, thanks, Siobhan. And I'm just going to direct one now to Siouxsie. My eye caught a question about cleaning agents, which I thought sounded interesting. How long will the virus hang in the air for and remain on surfaces? What's the most effective cleaning agent for all surfaces to ensure there's no cross-contamination or potential infection risk to any staff coming to work on the next shift?
So again, great question, and kind of depends again on what's the workplace, what's the risk, are we at level 4 or are we at level 1? I think one of the things where it feels like we're a bit stuck in is this kind of surface transmission. So the vast majority of transmission is through the air. And that's the thing that we have to really pay attention to. So the really important things we should be paying attention to are ventilation and filtration and things like that. How long it stays in the air kind of depends on what kind of environment is it. Is it a confined space with very little ventilation, or is it somewhere where there's lots of airflow and the air can move out? So it really depends on the space. In terms of cleaning, the normal cleaning agents work really well. You don't need anything fancy. And I worry about some of the claims of the products, you know, that you can put this on and then you don't have to clean for days. I mean, that's nonsense. Regular cleaning with the products that we use every day that we know work, they work really, really well. You know, this is the data shows that the virus survives on surfaces for about 3 days, but we don't know whether it's still infectious after 3 days. That's kind of one of the things. We know that it's quite fragile, so it does break up. You know, that's why washing your hands is awesome with soap is awesome, because basically soap breaks it up. So these are all things that will help, and I don't think we need fancy stuff. Just regular cleaning of areas, just like we would with other things, but paying particular attention to confined spaces. When we are in a situation where there is transmission happening in workplaces, it'll be because people are sharing the same air basically and working closely together like that.
Yeah, thank you for that. And I just want to again address another one to you, which is about some of the concerns that our members have expressed to us about the vaccination, saying that, you know, some people are concerned that millions could be dying worldwide from the vaccination itself. And also others are saying that that perhaps this whole idea of lockdowns it isn't properly scientifically based. The idea that we have to go into a lockdown, shouldn't we just learn to live with the virus? I wonder if you could speak to those two things.
My first okay, so it's really clear evidence that the vaccines are not killing millions of people. It's really, really clear that the virus is killing millions and millions of people. Learning to live with the virus is not learning to live with the virus, it's learning to die with the virus. So, you know, it has a high mortality rate for people who are not vaccinated, but it's not just about the people who die immediately, right? So we know now that long COVID is a thing, that a certain proportion of people who get infected will end up with symptoms for months and months and months. And some of those symptoms will leave some of those people unable to work. They will leave people with racing hearts, not able to exercise, with brain fog, all of those kinds of things. And what we're seeing at the moment is just the short-term effects on health. What I really worry about is what we're going to start to see in the next 2 years or 5 years or 10 years in people who've recovered. We're going to see probably more diabetes, possibly more dementia. We're going to see all sorts of impacts because the virus basically can infect all sorts of different cells in different parts of the body. And the other thing that's starting to pop up now, which is something that we haven't heard much of, but we're starting to see case reports from doctors, is that there are people who weeks and months after having an infection are starting to suffer from what we call sexual dysfunction. So things like erectile dysfunction, not being able to ejaculate, or taking a long time to ejaculate, and that may well impact on fertility. So there's really, really clear impacts of being infected. And I think that when we talk about learning to live with the virus, it's basically acknowledging that a large number of people are going to die, and a large number of people who are infected will have long-term health consequences, the likes of which we have probably never seen before.
Wow, that's pretty clear, Siouxsie. I just wonder, we're running out of time, and I'd like to ask both of you a question to respond to. Maybe go to you first, Siobhan. How do you think we should go and talk to somebody who's vaccine hesitant? There are probably a lot of people listening tonight who are coming up against arguments from colleagues or members of the family who don't want to have a vaccine. What do you think helps in that conversation? Siobhan, do you want to have a couple of comments about that?
Yeah, sure. First of all, I think it's important to acknowledge that we're vaccinating everybody over the age of 12 in New Zealand, and for a lot of those people, having a vaccination, having two, is not something that they thought they'd be thinking about. So, people over 65, they get the flu vaccine, they know about that. We kids, they get vaccinated all the time, but the general adult population doesn't get vaccinated all the time. And so they are worried. It is different. There's so much information out of there, and on Facebook and Twitter and whatnot. And Siouxsie's absolutely right. I'd say 90% of it is incorrect and is being put out there for other means, to make money and to sell other sort of political views and that sort of thing. So trying to work out whether you want this thing which is foreign and hurts and you have to go to a funny vaccination centre is a really big deal. So just acknowledging that. The best way of looking at it, though, is, again, coming back to what Siouxsie said, is that to protect our community, we all need to step up and do this. This is about doing it together. I obviously had the vaccination because it's important to me and I understand the science, but I also had it because I want to protect my family. I don't want to bring COVID home to them. And that's going to be really important for E2 members as well, because you guys are all still working.
Yeah.
I think it's really important that we get this done for each other as well as ourselves.
Yeah, I think that's a powerful message in a union Facebook Live, that this is about the collective. Siouxsie, some last words from you.
Yeah, I mean, so I'm somebody who studies infectious diseases. I remember when my daughter was born, and she was born in a part of London where they gave the BCG vaccine, which is the TB vaccine. And at the time, I was a TB researcher, and I understood as a researcher all about the vaccine, knew all about its safety, knew how it worked, knew everything. And when my little 2-day-old baby was in front of me being given that vaccination, I remember thinking, oh, I don't want to do this. She's so little. But so I understand when you have that feeling that, oh, I'm not sure I'm doing the right thing. What I can honestly say to you is that this is the right thing to do. And those who are trying to get you to do otherwise are not doing it in your best interests. They really are not. And it's so upsetting to see doctors and scientists pushing this other idea that we could just somehow just let people die. It's just insane. So I know how hard it is, and I know that feeling of, oh, I'm not sure. Actually, you know, we get this gut feeling. It's kind of a it goes back to kind of, you know, our evolutionary history of getting this feeling in our gut that something's not wrong. Sorry, something's wrong. We have to fight that this time, because this is the right thing to do, both for us individually, because even if you are someone who's very healthy, you know, this disease is really hard, and the vaccine will help, but it will also protect all of us. And that's what's really important.
Thank you, Siouxsie, and thank you, Siobhan. I've found it absolutely inspiring to listen to you tonight, and I'm sure that others have as well. I know that this will get shared a great deal, and I hope the messages that you've given to our members go on getting shared many thousands of times. So I just want to say I appreciate so much what you've done, and I'd like to hand it over to Bill to make a few final comments before Muriel closes.
Yeah, thanks for that. And I also would like to thank our speakers so much for this tonight, and our staff, our eTU staff who've arranged this and made it possible. Can I just add to that last session something we don't often talk about, and that is that some people, many people, actually feel nervous about having an injection. They're going to have the vaccine. They don't have a problem with the science of the vaccine. They just feel very nervous about the fact that they're going to have to go and have it. And I'd like to just tell you, and I'm sure others on this meeting who've had at least one shot, I've had two, I think we would all say, not only is it painless, you don't even know you're having it. And it is so easy. And just a little hint, particularly if you've got a family member, maybe a younger person who's quite nervous, as you're about to have the shot, you breathe in, breathe out, all over Rover. So thanks again. Look, members, these are challenging times, and we know that, but we can get through this together. So stay safe and be kind. Be kind to your families. Thank you for being an eTU member.
Thanks, Bill. And just before I close, I just want to also give my thanks to our guest tonight. I just want to acknowledge the important work you're doing on the front line, Siobhan, in primary care, and also to you, Siouxsie. Can I just also take the opportunity, Siouxsie, to also congratulate you and acknowledge you as a New Zealander of the Year, following in the steps of our eTU sister, Christine Bartlett. I think that last session for me was fascinating, and I was lucky as a health worker to have both my vaccines back in April. But I think Siouxsie, and I did it because I wanted to protect my whānau and whakapapa, and I think, Siouxsie, that what you described in terms of the unknown, we are yet to find out in 2 years, 5 years, 10 years down the track, the impact on those who haven't had the vaccine. I think for me has taken that whole vision of, I took the vaccine to protect my whakapapa, and I think you've just kind of pinned that down really succinctly. And I just appreciate the messages that you've left with our membership as well. If it doesn't feel right, if it feels against how we would naturally respond collectively, and something's got to be wrong with it. So thank you for that. And I'm just going to bring this session to a close, and also just reinforce what Bill said, to thank our staff team, and to thank our members wherever you are tonight, but especially if you are in Auckland doing the heavy lifting for the rest of the country. Just appreciation and our support too. Thank you. So kia tātou katoa, te ata whai o te tātou ariki, amene. Thanks, team. Ka kite.